In 2019, the state of Nevada ranked 35th in population health in the United States. This is in part due to high rates of cardiovascular disease, chronic health conditions, and premature death. A number of factors can influence a population's health in a given geographic area, one of which is a person's genes, which can show an individual's likelihood of developing certain diseases. With this in mind, a team of scientists came together in 2016 to launch the Healthy Nevada Project, a genetic screening program that targets 3 of these diseases, each of which can be treated, prevented, delayed, or reduced with the appropriate clinical actions. These diseases include hereditary breast and ovarian cancer, familial hypercholesterolemia, which is your body's inability to remove bad cholesterol from the bloodstream, and Lynch syndrome, the most common cause for hereditary colon and endometrial cancers. That's why these 3 diseases are a top priority for the Centers for Disease Control.
So far, we've collected the DNA of more than 50,000 people in the northern Nevada region, and we're able to match that against about 1 million patients to look at healthcare outcomes and the genetic mutations that might be associated with those.
Today, nearly 5 years since the launch of the Healthy Nevada Project, this team of scientists are coming up with important findings that just might change the way we take care of our health.
We learned that 90% of the cases for these CDC Tier 1 conditions are missed in the clinic. That's important because we know if we detect those cases early, we can lower mortality and morbidity. That's basically sickness and death.
Although research shows only 1 to 2% of people have this genetic risk for developing these diseases, the Healthy Nevada Project's findings show that a vast majority of these individuals will never learn of their elevated risk in traditional clinical care.
But people think of it in a linear relationship. Oh my God, I've got the BRCA gene, therefore I will have breast cancer tomorrow. No, that's not how it works, actually. And so helping people understand the contributory risks to the occurrence of disease, I think, is meaningful. It's not a death sentence because you happen to have a genetic predisposition. The gene may never express itself in a way that's meaningful outside of there. So we've had misconceptions that we've had to overcome.
But by understanding how their genes can increase their risk for disease, people can still take proactive measures in taking care of their health.
We look at the genes and we ask whether or not there are mistakes that cause problems. And those mistakes are the equivalent of proofreading a manuscript and seeing the word necessary and finding that it's spelled necessary with an I or necessary with an M, necessary. And necessary is not a good word. Necessary is a really good word. And so we look for the necessary words in the genome that are associated with certain types of diseases. And we inform individuals about those mistakes so that their doctor can then take the appropriate next steps.
Much of the American healthcare system is reactive. A person comes in with XYZ symptoms, a doctor provides a diagnosis and offers treatment. With the Healthy Nevada Project, however, the goal is to transition from a reactive healthcare system to a more preventative one.
When we first started talking about this, a lot of people were saying like, oh, great, you're going to find better ways to treat disease. And, from my perspective, being a cardiologist, I don't want to treat disease. I want to prevent it. I want to find out ways that we can find people who are vulnerable for heart attacks and are, prevent them from ever happening.
And I think too often we've lost sight of what the health needs are and the preventive aspects. So doctors get enculturated over time in making sure that they're treating illness and disease. And in some ways, it's not as sexy to deal with the prevention of disease, when in fact, that's the holy grail in terms of what you might be able to do to really address how to help people enjoy a better health status.
Understanding health risks in a community doesn't stop with genetics, as the Healthy Nevada Project is also looking at how social behaviors and environmental factors can also affect people's health.
And so some of the data elements that we've used include data from the Environmental Protection Agency looking at daily air quality fluctuations to see if those air quality fluctuations somehow contribute to people going to the emergency department with asthma problems, COPD. So we've got environmental data. We're involved in a study where we're going to look at people's well water to see if the quality of their well water is related to any of their healthcare outcomes. We have all the death certificates for the state of Nevada going back a decade, and we can use those to do things like survival analysis, which is a statistical tool that allows us to look at, for example, the efficacy of a drug to see if after a heart attack they survive for 5 years. We have data that is every single emergency department visit across the entire state for the past 10 years and what the cause of the visit was. So we've identified areas of food deserts in the city of Reno using tax assessor data. So data is everywhere. And if we think it might help tell the story, then we'll certainly pull it in.
And the idea is that we could integrate the major social, genetic, and environmental determinants of health to identify where the health and healthcare risks for our community might be. The idea is that if you identify the risks, you can help people modify their behaviors so that they can minimize those risks and live healthier.
By understanding how social behaviors, environmental factors, and genetics can influence the health in a state like Nevada, we can improve the overall health status of our communities. Therefore, project leaders say initiatives like the Healthy Nevada Project, with the added element of genetic testing at a population-wide level, just might change the way healthcare is practiced in the future.
So we think we have sufficient evidence, and others around the country have that evidence too, that we should be screening the population more broadly for these CDC Tier 1 conditions. We want to detect those conditions before they manifest as really significant heart disease or stage 4 cancers. We found that through this population-based screening approach, we're finding a lot more of these conditions than we're finding in the clinics. And so I think what you're going to be seeing in the not too distant future is more and more screening for these 3 conditions when individuals become 18, for example, when they become consenting adults.
Imagine the day where today, somebody like you can spit into a tube and we can say, okay, here are the 15 diseases you're never going to get. Here are the 25 diseases you're vulnerable to get, and here's 3 diseases you are really high risk of getting. Well, that's your genetics, and that you carry that with it your entire life, and that will never ever change. Now, if you can imagine one day if you choose to have kids or do anything like that, your genetics go to your kids. So now we have the ability to then predict what your children's health is going to look like and the next generation's health is going to look like. So going forward, we have all of this information that just gives us the ability to prevent disease for generations to come.